February is Healthy Heart Month, and KTBS and Krista's Health have joined together to keep you informed about heart disease. A local nurse shares her scary story of what it was like having a heart attack after giving birth. In May of 2024, Lizzie Rintz gave birth to her fourth child. After a smooth pregnancy and delivery, they went home with a healthy daughter.
About 9 days later, the morning was fine. My little boy was holding her in the bed. We were taking pictures, doing all the things we needed to do. And then I started feeling just some tightening in my esophagus, just right here in the middle of my chest.
The tightening in her chest was on and off, but it progressed to dizziness or haziness. As a nurse, she decided to check her blood pressure, which was, as she described, through the roof in the 180s over 120s.
I was taking my blood pressure about every 2 or 3 minutes and it wasn't resolving, and then the pain started expanding around the sides of both sides of my chest and then down the back sides of both of my arms into my elbows, and it was just a constant, very, very, very deep, intense aching feeling.
After about 15 minutes, her symptoms were not improving. She went to the emergency room at Krista's Health, where doctors tested her troponin levels, which is a protein in the heart muscle, and when increased, this can be a sign of a heart attack.
The troponin level was increased enough for them to say that, I had actually had a heart attack, which was a huge surprise to me.
Lizzie was diagnosed with spontaneous coronary artery dissection, or SCAD. It's a rare condition when the walls of an artery tear, causing a blood clot and a heart attack. It's different from plaque formation, which slowly closes the artery over a long period of time. SCAD can happen very quickly and spontaneously. Dr. Trey Baucom, the cardiologist on call, decided against standard treatment like a heart cath, which could have made things worse. Instead, he recommended a more conservative approach to manage her symptoms, which was to basically do nothing.
So the best thing to do is to take a deep breath, try to control the discomfort, and as long as the patient is not hemodynamically unstable, it's best to treat them conservatively.
SCAD is very rare postpartum, but of people that have SCAD, most of them are postpartum. About 80% of people that suffer from SCAD are either pregnant or recently pregnant.
Every time I moved, every time I felt a pain or discomfort, I was immediately thinking that this was another heart attack. It's going to happen again. All that can be very, very normal. Your body's just healing. It's a pulled muscle. It takes a while to heal, and just reach out and find and support, other people who've experienced this before. And we've had some of the same stories, so that's been helpful.
If you are pregnant or postpartum and you start having chest pain like Lizzie, you may need to seek immediate medical attention because it could save your life. For more information about Healthy Heart Month, visit our website at ktbs.com/healthyheart.